Moving on, we're going to talk about chronic conditions that are common for older adults and their management. We've seen a major shift in the leading causes of death for all age groups throughout history. It used to be that people would die of infectious or acute diseases such as diarrhea, pneumonia, and broken bones. Now we see more people dying of chronic degenerative diseases. Chronic conditions are long-term, most often permanent, and may require a hospital stay. They are the leading causes of death for older adults. 80% of older Americans have one chronic condition. 50% have two or more. It can be difficult to diagnose due to overlapping symptoms and natural changes of aging that may present as symptoms of chronic conditions. Genetics, lifestyle, and other factors all play a role in chronic conditions. Access to care is one of them. Cardiovascular disease is one of the common chronic conditions. More than a third of Americans are affected, and the incidence increases with age, leading the cause of death among many groups. Risk factors for cardiovascular disease include obesity and diabetes, which are increasing even though rates of cardiovascular disease are declining for men. For women, rates are catching up to men. There are three main types of cardiovascular disease: congestive heart failure, angina, and myocardial infarction. Congestive heart failure is when cardiac output and the ability of the heart to contract severely decline, so the heart becomes enlarged, pressure in the veins increase, and the body swells. Angina is when oxygen supply to the heart muscle becomes insufficient, resulting in chest pain. Usually the pain and pressure only last for about 5 to 10 minutes. For a myocardial infarction, oxygen supply to the heart muscle is severely reduced or cut off. This is also known as a heart attack. This can be presented differently among men and women. Also, women and older adults don't usually realize they're having heart attacks until it may be too late. Age-related atherosclerosis, or hardening of the arteries, is also a concern, and may lead to cerebrovascular accidents, also known as strokes. Arthritis is another common chronic condition among older adults. It is a disease that attacks the joints, causing them to be painful and stiff. There are three main types of arthritis: osteoarthritis, which is when the cartilage rubs away, causing pain and stiffness; rheumatoid arthritis, which is an autoimmune disease, meaning the body attacks itself and may even damage the nervous system; and gout, which is very painful and usually presents in the big toes. Foods rich in purines, such as liver and dried beans, alcohol, being overweight, and certain medications may be risk factors. Diabetes mellitus is another common chronic condition for older adults. Type 2 is the most prevalent. It results in difficulties in insulin production or action, or both. This is also known as adult onset diabetes. About 8.6% of Americans 65 and over have this type of diabetes. It can lead to complications such as blindness, kidney damage, and cardiovascular disease, as well as lower limb amputations. You can see on the right here that the rates of diagnosed diabetes vary among different ethnic groups. You might wonder what might explain these health disparities, and it's important to remember that while we should consider genetics, lifestyle, and perhaps more importantly, access to healthcare should also be considered. Finally, cancer is another really common chronic condition. This is resulting from many diseases in which the genetic material in cells becomes damaged or changed. Some of the causes of cancer are known, such as toxins, radiation, and excessive alcohol use. Other causes are not known. About 63% of people diagnosed live at least 5 more years, and over 50% live at least 20. So many people are living with cancer. 78% of the people diagnosed are 55 years and older. The most common types of cancer include breast cancer, especially among women, and prostate cancer among men, lung and colorectal cancer. Make sure to read The Prostate Cancer Dilemma on page 111 to better understand why there is a current controversy. Incontinence is another common common problem among older adults, and it is the loss of ability to control the elimination of urine and feces on an occasional or consistent basis. There are four main reasons for incontinence. The stress is when there is pressure in the abdomen that exceeds the ability to resist urine flow. It can result from coughing, sneezing, or heavy lifting. The urge reason is a result of the central nervous system having an issue after a stroke or a urinary tract infection. A person simply can't make it to the toilet in time. Overflow is simply the improper contraction of the kidneys, leaving the bladder overdistended. And functional is being unaware of the need to urinate due to a disability or cognitive impairment. It's also important to note that with age, the bladder decreases in size, and the Mecturian reflex, which signals the need to void, becomes delayed. These are normal changes of aging, but you can see how it would be easy to confuse these normal changes with symptoms of worse chronic conditions. We're going to briefly talk about pharmacology and medication adherence. In terms of patterns of use, many older adults use NSAIDs, or non-steroidal anti-inflammatory drugs like ibuprofen and acetaminophen. These are non-narcotic medications that treat moderate pain in older adults. Morphine and codeine are commonly used as narcotic drugs to treat severe pain in older adults. Older adults take more medications on average than any other age group. This is called polypharmacy, or multiple medications, usually 6 or 7. They often use both over-the-counter and prescription drugs, especially with multiple chronic conditions. Until the 1990s, clinical trials of new medications were not required to include older adults. A lot of this is due to age discrimination, so they were not selected for studies and were not required to be selected for studies. Therefore, we often don't know about the effectiveness and risks for older adults compared to younger groups of many drugs that are currently on the market. There are certain developmental changes that factor into how medications work on our bodies as we age. So absorption is the time it takes to enter the bloodstream. So for example, from the stomach to the small intestine. And this length of time is actually longer as we age. Distribution is medications actually binding with plasma proteins to get them out of the bloodstream. And more amounts of these remain free and build up in the bloodstream, resulting in more toxin levels as these drugs build up. Metabolism is cleaning up the medications from the bloodstream, which is the liver's job. This also slows down with age. Finally, excretion is the elimination of medications through urine, feces, sweat, and saliva. This also slows down with age. So what does this mean? The main takeaway is that reducing the number of medications and improving adherence to medication regimens is extremely important. Doctors should consider lowering dosages if possible. Generally, the idea is to start low and go slow with medications. Finally, we're going to briefly talk about functional health and disability. What do we mean when we talk about functional health status? Generally, what we're talking about is how well a person is functioning in daily life, but this actually requires careful assessment, especially when considering a person with a chronic disease. A disability is generally considered an effect of a chronic condition on someone's ability to engage in activities. Frailty is advanced disability, a condition in which a person has physical disabilities, illness, and possibly cognitive, psychological disorders, and needs assistance with activities in daily living. They may have trouble with daily tasks, and this is most prevalent among the oldest old, or the people who are 85 years and older. So what leads to disability? In a long-term study over 3 decades by Strawbridge and his colleagues, there were certain common risk factors that were determined to be most significant for disability in old age. These include smoking, heavy drinking, physical inactivity, depression, social isolation, and fair or poor perceived health. So these are risk factors for disability in old age. We will look at some of this evidence throughout the term, but one thing I want you all to remember is that these are public health issues. Many of the factors that control our health are actually out of our individual control, which is a primary tenet of public health. It's also to remember these key points. Socioeconomic status and health-related quality of life are highly correlated, and these patterns hold globally. Please keep these in mind as we move forward and discuss social policy implications.